Hi, I'm Dr. Matt Sheehan from Medford Family Chiropractic Center in Medford, Oregon. This is January 2018, and I'm here today with my friend Julie to demonstrate several stretches that I use commonly in my practice. And for the sake of my patients who might be watching this on my website, these are the handouts that we'll be referencing. So this is for you guys if you're having trouble figuring out what the heck I was talking about when I demonstrated them for you in my practice. Okay, so these are for gluteal muscles in the side of the gluteal region. Very common, very common causes of gluteal pain, leg pain, contribute also to low back pain. And so basically you're stretching them out if we found those muscles to be riddled with trigger points or very tight muscles, or found them to be just weak. So we're going to be stretching these out, and these are very effective to do at home. So I'm going to show you on the model here just roughly where they are. So this is the view of the spine and pelvis from the back. And so this is the pelvic region, the buttock region, both sides, left buttock, right buttock, and the trigger points in question are generally towards the top and the outer part, right in here on both sides. And like I said, often extremely tender. So now I'm going to have Julie lie on her side, and we're going to demonstrate the correct way to stretch these muscles. And so generally, there are two areas where we want to stretch. There's often a trigger point towards the front, and there's often a trigger point slightly behind it towards the back this way. And we're going to stretch those two separate ways. And first, I'm going to show you how to stretch the one in the back. This is basically what you want to do. You can do this at home, either on the couch or on the bed. You're going to bring your body to the front edge of either the bed or the couch. So Julie, I'm going to have you just scoot your body as close as you can to the edge. If you can scoot just a little closer, it'll be a little easier. Good. Okay, so you're going to get as close as you can to the edge, and then you're going to want to straighten the bottom leg out. Actually, bend it like this, but just have it back. There we go, like that. That's good for stability. And now this leg, we're going to bring over right about here and let it hang. We're going to counterbalance so Julie doesn't fall off the adjusting table. We're just going to balance it back by rotating her torso back that way a little bit. So you feel stable there?
I do.
Good, okay, good. So this leg is hanging. So we're already starting to stretch that muscle group right in there. And every person is different as to the exact position of the leg and the torso and the pelvis for where you're gonna feel the stretch in the right area. This is an especially important area to demonstrate with a video, because there's some tricky little details that will make or break whether the stretch works. Okay, so first thing we want to do is use the downside arm to come over like this, and this is going to be the arm that's going to manipulate this leg. The more you can relax this leg, the better it'll be. That's why you want this arm to do most of the work. So this arm is going to pull up this way, and I'm going to just instruct Julie to just pay attention to when she starts to feel the stretch right around in here. And if she feels it somewhere else, to let me know that. Okay, so just slowly pull this up, and like I said, it takes a while to figure it out. So you feel any stretch there anywhere?
A little bit.
A little bit. Want to show me where?
Yeah.
It is in the right area. Okay, so we hit the jackpot right away. A lot of the time, people will say, oh, I don't feel it anywhere in my pelvis. I feel it in my hamstring, or I feel it really in my low back or in my upper back. And sometimes this is because those are your tightest areas. So what we're going to do is we're going to bring you just a little closer to the edge if you can. Can you scoot over just a hair more? Good. All right. So once again, pull that up. And now what I want you to try doing with this hand is try and push it. Once you figure out the position this way where you're feeling it in there. You right about there? Okay. Now just try and push the leg down towards the floor a little bit. and see what that does to the stretch. Does it amplify it or make it go away, or does it change it at all?
It amplifies it.
It amplifies
and it radiates a little bit up.
A little bit up top. Okay. Does it feel like a stretch, or does it feel like pain?
A stretch.
Okay, good. So we hit it lucky. With this one, we got it early. Sometimes you have to change the way the torso is. You might have to straighten the torso out a little bit to take the stretch out of here. You might have to try this. You might have to try pulling your pelvis back this way a little bit. And then you go, oh, now I feel it in the right place. Because if it's this way, sometimes it's going to stretch up here. Okay, so vary the position of the pelvis this way a little bit. And also play with the leg coming up this way. And you got to figure it out for yourself which is the exact position you need. And then also the leg going down towards the floor. You can see it rotating the pelvis a little bit. Somewhere along in this vector, you'll find that it will stretch in the right area. Okay, so you just got to play with it for yourself. And when you get to the point where you feel the stretch there, you want to hold it there for about a minute. And as you feel that stretch starting to ease up, then you want to, with that downside hand, you just want to push it slightly down more towards the floor to maintain that feeling of a stretch for about a minute. Okay, so that's for the back trigger point. And now we're going to show you the one for the front trigger point. So it gets even fancier with this one. What we're going to do now is we're going to have Julie just scoot her whole body towards the back edge of the table. So if you're lying on the couch, you're just going to have to flip yourself over. And so you want to be along the back edge. There we go. And now with this one, what we're going to have her do is bring this top leg, or the bottom leg, up for stability, like that. Now the back leg is going to come back this way, and you're going to want to hang the leg off the back edge of the table. And you can see, obviously, she's really got to rotate. She's got to counter-rotate her chest forward so she doesn't fall off the darn couch or bed, right? So the leg comes back, pelvis comes forward so she feels stable, and if she's got an edge up here, like on the bed or something, she can hold on there. And so she's going to bring the leg back just enough so it can hang off the edge of the bed. And now what you're going to do is you're going to take this downside leg, the ankle of this one, and you're going to use this to manipulate this leg. So it's a little fancy. So what you're going to do is you're just going to bring this over like that, and you're going to use this ankle to very gently, because you have a lot of leverage, use this ankle to push this top leg down, just like you were doing with the hand on that last stretch. And we're just going to use it to put light pressure downward on the leg this way. And you can see Julie's moving around. She's finagling just to get herself in a position where that will work. Okay, so you just got to figure that out for you. But you want to get in a position where this ankle can push down on the leg just a little bit to increase the stretch up here. Now, you may initially not feel it here at all. You may have to, the vectors you typically, or the directions you have to maneuver to get it to stretch in the right place are the same as the other one. You're going to have to move the pelvis, try moving the pelvis this way, try moving it slowly back this way while you're pushing down. And that's most of the finagling you'll have to do. And you may have to push down a little harder on the ankle right here in order to get it to stretch. Are you feeling anything remotely up here?
I'm not. I feel it back here.
Right. Okay. So the other thing, if you notice some pain back here, or if you feel any kind of discomfort, what you can do is you can try moving your torso forward a little bit just to take the curve out, or you can try to scoot it forward just a little bit like that. That often will help this a little bit. Okay, and once you get it dialed in here and you're pushing down, you feel stretch, you want to hold it there for about a minute, and as you feel the stretch starting to gradually ease up, you're going to put a little more pressure with the ankle, and as it relaxes and the leg goes down, what you're going to have to do is just slide the ankle up a little further on the thigh so you have some leverage to push down, and you hold it for a minute. Sounds a little complicated, but once you try it a couple times, you'll see it's not that big a deal, and it's a great way to stretch this out. So with both of those stretches, it's good to do that after after you might be using either the Back Buddy S-shaped trigger point stick or tennis balls or racket balls on these muscles directly, either against the wall like this or on the floor, or you might be using a foam roll and rolling those muscles out. But good to do something, some direct pressure on that muscle first, trigger point therapy style, the method of your choice, and then do the stretch. And again, stretches, you can do them every day. Strength exercises, every other day. With the strength exercises, if you do them every day, you're going to get weaker, not stronger. Okay? Thanks.